the new health care plans get ready to kick in, brand new Fox polls are showing that many Americans remain skeptical and simply aren't happy about it. In fact, more than half of those polls say they wish the health care law had not passed at all. Take a look at the numbers. Joining us now, Republican Congressman and orthopedic surgeon, Dr. Tom Price. Welcome. Great to have you here today.
Hey, Uma. Thanks. Good to be with you. Thank you.
We are just days away, as you know, from the first phase of Obamacare kicking in, and there are still a number of concerns, as we've been pointing out. First off, though, even if you think you have enrolled, we are hearing that there are problems with processing the information that if you show up at your doctor's office, for example, on January 1st or shortly thereafter, you're expecting that you're covered, your doctor's office may have no record that you are actually indeed covered. What are folks supposed to do then?
Well, it's a real challenge. This is the back-end questions that have been asked for the past couple of weeks. We're transitioning from the sign-up period for Obamacare, for the Affordable Care Act, into the implementation and into the actual service of health care for individuals. As a physician, I can tell you that the doctors that I talk to who are trying to run their offices and trying to determine whether or not people who have come to them are going to have proof that they're actually insured and whether they can care for them don't know that answer yet. Here we are, the last part of December. This starts on January 1st. There are real problems that are going to occur, and sadly, this is going to affect people's quality of health care. And as a physician, I know that the quality of health care is the most important thing to the vast majority of the American people, and they're not going to have the kind of health care that either they had before or that they think that they purchased through this program.
So, if you have insurance, for example, you may have some problems going forward getting the doctor that you would like to see, since those plans are likely not to give you the access to the doctors you want or to the hospitals that you want to have your care given to you.
Exactly right, and we're seeing that right now as the provider panels, the number of doctors that will be able to see patients through the Affordable Care Act or through Obamacare. They're diminished panels, they're narrowed panels, so the likelihood is that you're not going to be able to see the doctor that you saw before. Here in Atlanta, 4 of the top hospitals in this city are not eligible for provision of care in Obamacare. That's not even beginning to talk about the kind of medications. We're seeing shrunken drug formularies. So a medicine that you and your doctor worked out and helps you with a certain problem, that drug may not be available to you. And this is even before you get the first invoice or the bill for it or the first care that you're going to receive under the program itself, and you're going to see that the deductibles are significantly higher.
Obamacare will actually start to resemble Medicaid if insurance payments remain too low and that doctors actually refuse to see patients?
Well, it's a concern that I've had for a long time, as have others. The fact is that with the narrowing of panels and with the decrease in payment to physicians, you're not going to be able to see the doctor that you thought you were going to be able to see, or go to the hospital or the clinic or the facility that you thought you were going to be able to go to. That's looking much more like a Medicaid program, which is providing a lower quality of care in many instances and significantly decreased access to care. And that would be okay if the prices were low, maybe, but in fact the prices are going to be higher than what folks were paying for a kind of a health coverage that they liked and that they wanted to keep and that the president said they could keep. Now they can't.
Now, I know that you have some alternate ideas and introduced the Empowering Patients First Act, which focuses on patient-centered solutions. The president has been saying all along that he's open to listening to new ideas from folks on both sides of the aisle. Have you had any luck so far getting a meeting with him?
No, we actually called out to the president in one of our hearings a month or so ago and gave my telephone number to the office to the president. I said, look, we've been asking for over 3 years now to have a meeting with the president and talk about patient-centered reforms that put patients and families and physicians in charge of health care, not government. We haven't heard from the president, certainly, and the president, I think, is going to be clamoring for real solutions, because what he's put in place doesn't solve the health care challenges, in fact, make them worse. We've got ideas, I believe, that would solve the health care challenges, get folks covered, solve the insurance challenges, and then we can save hundreds of billions of dollars. Over $2 trillion over the first 10 years has been estimated by the bill that we've proposed. That's the kind of program that the American people want.
Congressman, a lot is riding on this come the new year. We're going to keep close watch, and of course, I know you will be too. Keep us posted. Thank you for joining us.
Thanks, Uma, so much. Happy New Year.
Happy New Year to you too, sir.